Healthcare without simulation would be a dangerous place.
I feel like without healthcare simulation, everyday real life would be a mess.
It would be not a friendly place and a dangerous place without simulation.
We use it to predict or eliminate situations in which in real life could be altered if we didn't have those simulators available.
Before working in simulation, I worked as a paramedic. Simulation kind of gives us the opportunity to not just train ourselves, but to test our institution's procedures and policies so that we can find weak points and then work to eliminate them so they're not a threat to the patient.
Healthcare has relied on an apprenticeship model, but today we have the ability through simulation to take human life out of that apprenticeship model. The aerospace industry does that, the military does that, the nuclear industry does that, the oil industry does that. Now healthcare has joined the ranks of those that are using simulation to take risk out of the equation ultimately.
We often think of simulation as something that improves patient outcome, which it absolutely does in the sense of, did they do the right clinical procedure? Did they give the right medication? Did they meet the right diagnosis? I also think it has more of a subtle advantage than we give it credit for. So often through simulation, we learn how to communicate better. We learn how to be empathetic. And it prepares health practitioners to deal with the human factors and the humanity often as much as it does their clinical scope of practice.
People in simulation are making a real difference. They are having that domino effect. They're very much the vanguard of change. And people in simulation need to know that, and they need to know how grateful we are for the opportunity and the privilege to support them.